What do you like? Tell me what you like.
There's value in that because it almost gives the brain like a vacation, right?
Holistic health is completely underappreciated, but so critical. Eating whole foods, and the key is just to find something that you really enjoy.
Welcome to the NAMP Nourishing You podcast. I'm Kristen Burkett.
And I'm Diana Wally. We're your hosts for NAMP's podcast dedicated to connecting holistic health enthusiasts with each other to share practical information from the holistic wellness space for enhanced vitality.
Diana and I are master nutrition therapists, board certified in holistic nutrition with private practices and an online joint venture that supports clients and practitioners as they strive to reach their full potential. We're honored to be hosting this podcast for NAMP and connecting our listeners with the latest in holistic wellness.
And if you enjoyed today's show, help us out by commenting below, liking this video, and subscribing to the channel to help us spread the word.
This episode of the Nourishing You podcast is brought to you by Good Fight.
Hi, everyone. Welcome to this episode of the Nourishing You podcast. We're looking forward to diving into a topic that is way too common, but very neglected in health conversations, which is high blood pressure with Dr. Ellie Campbell. Dr. Campbell has been board certified in family medicine for over 30 years, and she also holds certification from the American Board of Integrative Medicine. She trained at the Medical College of Georgia in the Bale-Donin method and through the cardiometabolic program at the Institute for Functional Medicine. She's an expert in cardiovascular risk reduction. A solo physician for 18 years, she has specialty interests in interdisciplinary collaboration, bioidentical hormone replacement therapy, reversing chronic disease, natural treatments for high blood pressure, and the oral systemic connections. She has been an advisory board member to the International College of Integrative Medicine and the American Academy for Oral and Systemic Health. She's an author, mentor, and international speaker who enjoys live theater, gardening, healthy cooking, hiking, travel, playtime with her husband, her 3 adult daughters, and 2 100-pound dogs. Welcome to the show, Dr. Campbell.
Thank you so much. It's absolutely my honor to be here today with you and to share some of my thoughts and experience about helping to control this really silent killer that's affecting our community.
It's always exciting to interview a traditionally trained medical practitioner interested in integrative medicine. And you aren't just interested, you're all in, you're 30 years in.
Yeah. Well, I did conventional medicine for about 13 years. I worked in a community health center. I was the diabetes champion for the Health and Human Resources Diabetes Collaborative, and I did all that public health stuff. And I realized through 13 years, all I got really good at was writing prescriptions, and I really didn't make people better. I had maybe fewer complications from chronic disease, but I didn't reverse any, and it was very unfulfilling. Then my daughter got eczema. Eczema is so bad her little hands would bleed and migraine headaches at the age of 8. And so I asked my patients, what do I do to make this better? Steroid creams temporarily helped, but it didn't cure anything. And they said, you have to go see a natural practitioner. Well, I'm a DO by training. So body, mind, and spirit was always part of our training, but going to an integrative care practitioner was something new for me. And the first thing she said was, your daughter has a leaky gut. She has terrible food sensitivities. We did some testing. Gluten, dairy, eggs, soy, and corn had to come out of her diet. And when we did that, she cried. She's like, Mommy, why do I have to be so different? Why do you have to make my lunches? Why do I have to bring cupcakes to other people's birthday parties? And I said, you're teaching me something. You're teaching me something. And I had no idea it was going to change the trajectory of my career, because once I got started there, it led me down a whole path of food as medicine. And it led me down a path of healing a leaky gut, which led to adrenals, which led to thyroid, which led to bioidentical hormones, which changed my career forever. So, we all have a story, I guess. And my daughter's story is where I got shifted. So over the next 30 years, I started practicing more and more integratively and realized cardiovascular disease is the number one killer in our country, for crying out loud. Somebody needs to grab that bull by the horns and wrestle it. So I had a terrible tragedy of a patient, and I'd like to share her story with you. Is that okay?
Yes, please.
So Dee was 76 years old, and she was a spunky grandmother. She came to see me because her daughter had suffered from infertility and was unable to get pregnant for the second time. And so we helped her daughter get pregnant. And at 44, she had a beautiful second child. And she said, "You're so good at hormones. I think maybe you can help my mother. Her doctor can't regulate her hormones." So Dee came to see me, and we regulated her hormones, and we treated her high blood pressure, and we treated her high cholesterol, and everything seemed to be going really well because she had this much younger boyfriend that she had to keep up with for her line dancing and her partying and her four-wheeling and her gardening and all these things that she did that made her just such a spunky delight to chat with. And then one day her daughter called me shaken and crying and said, "Mama didn't come into work today." And I frantically drove over to her house, looked through every window and door, and I found her crumpled on the floor next to her computer. And she'd suffered a massive stroke. Mm-hmm. So she survived that event, and we live very close to a stroke center. So she was able to get top-notch, state-of-the-art healthcare. But so much damage had been done in an undetermined length of time from the time she had her event. So she didn't qualify for some of these new miracle drugs that are available to break up the clot. She was joking that she was going to have a lot of therapy because she was dragging one leg in order to do line dancing. She was paralyzed on one side. And then she developed this complication, and it happens in about 40% of stroke patients. It's called hemorrhagic transformation, and it's where the blood vessel that was damaged from the stroke became so weak and fragile that it hemorrhages. And she developed a brain hemorrhage, and Dee died. And I felt like I'd been gut punched because I was her primary care provider, and she entrusted me to protect her against the number one killer in our country, cardiovascular disease, in her case, cerebrovascular disease. And she died from a stroke anyhow, even though I managed her cholesterol, I managed her blood pressure, and she died. And so I spent the next 3 years studying everything that I could to try to figure out what caused this event. And it turns out that 2 weeks before her stroke, Dee had developed a toothache. She had a dental abscess, and she had an appointment to have her tooth extracted, but she never made it that far. Those bacteria from that dental infection got in her bloodstream and triggered a plaque rupture. And almost certainly, found on autopsy, we can't be sure, but almost certainly that was the triggering event. And so I started attending as many conferences as I could about oral health as it connects to systemic health. And I believe that this is probably the number one hidden risk factor to the number one killer in our country. And if we are more attuned to our oral health, and we can talk about that at length, we can move the needle on cardiovascular disease, because truly heart attacks are optional and strokes are stoppable, and dialysis is not your destiny if you can get your oxidative stress and inflammation under control, and oral health is a major contributor.
Wow. Gosh, I've got like goosebumps everywhere for lots of different reasons right now. You know, that's a really difficult but rewarding journey that you've been on to get you where you are today.
Yeah, I was
starting with your
shocked to
daughter
learn that somewhere between 48 and 49% of Americans suffer from hypertension. Half of us have hypertension if you define it as a blood pressure of 130/80 or higher, or taking medication for hypertension. That's over 120 million people in our country. Clearly, as healthcare professionals, we're missing the mark. If so many people are suffering from hypertension, what can we do as healthcare professionals to prevent 700,000 deaths that are directly associated with hypertension, right? There's a lot that we can do, and it starts at home. It starts with therapeutic lifestyle changes, and it starts with oral health, and it starts with really good nutrition. We can't eat that crap that's out there. You know, it's either junk or food. It can't be both. There's no such thing as junk food, right? one or the other. So if you're consuming that junk, food is medicine and food is information. And if you're feeding your body high fructose corn syrup and processed seed oils, they're going to cause a glitch in your system. They're going to drive up your oxidative stress and make your blood vessels spasmy and contracting. And we're going to result in an inability to get our blood pressure under control. And in fact, only 40% of people who are treated for hypertension get it under control. Only 40%.
Yeah, I believe that. I talked to so many people that are on blood pressure medications, yet their blood pressure is still high. Like,
yeah.
It's
and
not even,
there's some social determinants of health with that, of course. We know that people who are 3 times the poverty level in terms of income, they have the highest blood pressure control, 47%. So why is that? If they have higher income, well, they're probably buying higher quality food. They may have some fewer psycho-emotional stressors. They probably live in an area that is less polluted than someone in a lower income area that tends to be very close to the highway with all those pollutants as the cars drive by. So income matters. Insurance matters. 40% of people with insurance can get their blood pressure controlled, and 22% of people without insurance get their blood pressure under control. So there's certainly some social things that we need to be working on as a society to help our people who have lower income or inaccessibility to insurance to be able to reach the care that they need, or to get my book and start some self-care that might move the needle on their blood pressure without the requirement of a healthcare professional that might not even be accessible depending on where they live.
Well, I knew when I discovered your book, it's called The Blood Pressure Blueprint. I knew we had the right person to talk to. It's been on my mind to find somebody to talk to about blood pressure, because it really is not discussed. Like, I'm a podcast junkie. I never hear anybody talking about blood pressure, but it's ubiquitous anymore. Like, it's everywhere. So just like you said, I mean, and the statistic you threw out is recent. That's from a 2023 report from the American Heart Association that nearly half Americans 20 and up have high blood pressure. So I knew I had the right person to talk to. And so I'm excited to get into even more details here. Let's back up just a minute and let's make sure our audience is up to speed, because in the last few years, the guidelines on what high blood pressure is have changed. And I don't think a lot of people are really paying attention to that and still assuming that the old guidelines mean they're okay. So can we define the current guidelines for what high blood pressure is, and then maybe talk a little bit more about who is at risk?
Sure, absolutely. So I think, first of all, everybody's at risk, both genders and in between genders. It doesn't matter your gender, you're at risk for hypertension. We have a society that is plagued with this condition. My patients tell me sometimes, well, that's just because they keep lowering the limits. Well, they keep lowering the limits because the evidence is out there that the higher the blood pressure readings, the higher the correlation to heart attack, stroke, dementia, blindness, kidney failure, et cetera. So that's why the guidelines keep dropping. When I was in medical school, we were taught that a blood pressure of 160 over 100 was acceptable in a senior citizen. Well, just because it's common doesn't mean it's normal. And just because it's frequent doesn't mean it's acceptable. So by the time I graduated from medical school, we set the guideline of hypertension at 140 over 90. Well, the CDC and the American Heart Association in 2017 changed their guidelines, and we're now calling officially hypertension at 130 by 80 or higher, and normal blood pressure below 120/80. That means that only 119 or over 79 or less is normal. That's really low, right? And that's where my blood pressure lives, so I'm happy about that. But 119 by 79, that's a really hard guideline to go by. So then there's sort of that in-between category between 120 over 80 and 130 over 80. What do we call that, right? We call that elevated blood pressure. Many years ago, before 19, we used to call that pre-hypertension, like we have pre-diabetes, but they took that language away. So now it's just called elevated blood pressure, and 130/80 is your guideline. Now, interestingly, that's the American guidelines, and worldwide, the guidelines are different. There are some countries, World Health Organization and others, that still use 140/90, and some use comorbidities. We're familiar with this word comorbidity since COVID. It was kind of a new vocabulary word for many people, but it means, do you have other conditions? Do you have diabetes? Have you already had a heart attack? Do you have peripheral vascular disease? Are you a smoker? Are you obese? If you have these other conditions, we're a lot more strict about your blood pressure. So we're using that 130/80 number in even European guidelines for some people to say, well, that person with 130/80 has hypertension, but a healthy runner who has no other symptoms, we'll let them go to 140/90 before we're going to diagnose them with hypertension. So there's a little bit of individual variation worldwide, and depending on which organization your colleagues belong to. But for the most part, we're pretty strict now in our office and in the US about 130/80 as being the official diagnosis of hypertension. And it will serve us well to keep our blood pressure below that point. And I think it also helps to say to somebody that your maximum acceptable blood pressure is 130/80 rather than your target. Because as a clinician, when the patient comes to me and their blood pressure is 140/80, they're kind of close to target. We'll kind of be wishy-washy about it, and we'll check it again in a couple of months and see how it is. But if the language in the office is your maximum acceptable is 130/80, clearly 140 is too high, and we have to make an intervention. Because statistically, only 50% of blood pressure patients are controlled on one medication. 50% have one. We have to take 2 medications in most instances. And it takes, on average, 7 visits to the doctor to get this intensification hesitancy overcome. And so 7 visits to get your blood pressure adjusted. And I think if we use that word, that verbiage as patients to the doctors, what's my maximum acceptable blood pressure to you? Not what's my target, what's my maximum acceptable? And now we use that language, and now we're very clear. All right, I've been here twice. I'm above maximum acceptable. I've checked my blood pressure at home 17 times. 15 of those, it's above your maximum acceptable. I think we need to make an intervention. Let's talk about 2-drug therapy. Well, the good news is there's 1 pill with 2 medicines in it. So you still only have to take 1 pill most of the time. It's just kind of sneaky that it's got 2 ingredients in 1 pill.
That's super helpful. So we talked about the guidelines for high blood pressure. We talked a little bit about who's at risk. Tell us why we should care. So what are the consequences of untreated high blood pressure?
Well, if you think about a garden hose, and if I'm going to put a little crimp in the garden hose, what happens to the hose between the spigot where I turn on the water and the crimp? Probably nothing. It depends on how thick the crimp is, especially if I turn the water on slowly. But if I turn the water on really fast and there's a crimp in the hose, that hose very likely could spring a leak. And if you think about your vasculature is the same way. If your blood pressure slowly goes up, you may not have that big of a problem. But if it suddenly goes up because you're almost in a car accident, because you're shoveling snow, because you had an emotional fright and you have this high blood pressure, or a dental infection that puts bacteria into your bloodstream, now you can get a rupture of those blood vessels, and those little tiny microscopic blood vessels trigger an inflammatory cascade that causes a blood clot, and a blood clot can cause a sudden symptom such as a heart attack, a stroke, blindness, kidney failure, erectile dysfunction. All depends on where the blood vessel that's been involved got choked by these little tiny blood clots. So organ damage can happen suddenly, stroke or heart attack, or it can happen slowly, little by little, chipping away. And in those instances, we see dementia if those little tiny blood vessels are in your brain. we can see chronic kidney disease and kidney failure chipping away at the kidneys. So nobody wants to live their life on dialysis if they can help it. And keeping your blood pressure under control is one of the best strategies to prevent the need for dialysis, prevent a heart attack, and prevent a stroke.
All right. So we need to care. And I think, I think because, I don't know, I'm guessing here, but, as you said, sometimes it's hard to get physicians to even change the medications to get it to the acceptable limit, right? So the conversations, even in the doctor's office, are slim to none. It's almost like, because you said it's so common, it's become just accepted. But there are severe consequences here, and we need to care. And we need to not just be okay with, 150 over 100 and say, oh, well, I'll be fine, because my doctor hasn't said I need to do anything different. I think there's a lot of dependence on our physicians telling us when we need to make an adjustment, when we need to do something different. And so we've got to be our own self-advocate here, because when you're the one crumpled up on the floor from that stroke, it's too late for your doctor to say anything at that point. So we really do need to care.
Yeah, and that's part of the reason why I wrote the book, because I truly believe that information is empowerment. And the more that we have the information, the more we can advocate for ourselves in that encounter with our physician or our nurse practitioner or our physician assistant, who's ever providing our primary care for us. We need to have a conversation with them. And if you're better educated than them, because the last continuing education conference that they went to on hypertension was in 2015, and they haven't caught up with the new guidelines, it's an opportunity to educate, but we want to be kind about it, because they're seeing 30 patients a day. They're doing the best that they can do, but they're not caught up. If they caught up, they would be paying more attention. Furthermore, they probably didn't check your blood pressure right to begin with. I know I was doing it wrong for more than 15 years. I didn't know better. And now that I know better, we do better. So first thing, we got to check it right in the office, and we have to learn how to check it right at home. And those instructions are in the book. So it's not hard. It's just being smarter about it. We have this thing called white coat hypertension. It's a real entity in somewhere between 10 and 30% of patients, where their blood pressure is pretty good at home. But as soon as we put that white coat on, holy cats, their blood pressure goes crazy. Well, they don't live in my office, so I don't need to be medicating them at that level if their blood pressure is 30 points lower as soon as they leave my building. But there's also some people that have masked hypertension. And those are people often who are kind of good meditators and kind of good, they hide their feelings well, and they can get their blood pressure under control in the doctor's office when at home they're out of control. And so that's about 10% of people as well. They have masked hypertension. Doctor says I'm fine, but they don't check at home. So this is why home blood pressure monitoring has become such an important strategy. We didn't used to have the ability for patients to check their blood sugars at home. They could only check in the doctor's office. And we were terrible at managing diabetes in those days. Now that we have home blood pressure, home blood sugar monitoring, and even continuous glucose monitoring, where we wear a monitor on our arm, now that we have home blood pressure monitoring, and unfortunately, insurance isn't likely to pay for this. And I think that as a society, for something that affects 50% of our citizens, we need to be pushing the buttons of our insurance companies to say, I mandate that you cover home blood pressure monitoring. And I need you to buy me a really good machine and give me the technology to share the information with my clinician, because those home readings are what we use to make our therapeutic decisions about. And it might not take me 7 visits if I can see that you have 57 readings in 2 months at home that are out of control.
That's a really good point. And, when you brought up the continuous glucose monitor, is there anything in the pipeline that you know about that could be a continuous blood pressure monitor?
Yeah, they're working on them. They're not ready for prime time yet. There's wearables. Even the Apple Watch, I think, is starting to pilot a blood pressure continuous reading. It's coming. It's not here yet. But yeah, I predict 5 to 10 years, we'll have a continuous blood pressure monitor with a little alarm that, just like with your blood sugar, pay attention, things are getting out of control. And hopefully those early warnings will give us the information that we need to make an intervention to prevent a tragedy.
That'd be amazing.
Yeah.
So we know that it seems to be common knowledge, and I don't know if this is accurate, that blood pressure just goes up with aging, so that's just sort of a natural thing that happens. Do you agree? We know younger people can have high blood pressure. So what do you think is going on with that information that's being communicated? So that's one question. And then the second question would be other factors that are related to high blood pressure that other than what we talked about already.
Yeah. So the answer to your first question, I think, is yes and no. Okay. Yes, blood pressure goes up with age. But no, blood pressure doesn't go up with healthy aging. And so I think that's the distinction. I think that as people age, they begin to accumulate stressors, oxidative stress. Through normal aging process, we break down cells and tissues, and we need to eliminate those. It requires a lot of antioxidants to be able to do those metabolic processes and clear out all that metabolic trash. And if we're not getting enough antioxidants, we'll build up this oxidative stress. That's essentially internal rust, and it will rough up the inside lining of our arteries, and that makes them more prone to get plaque and calcium, and that stiffens the arteries and drives up our blood pressure. So I think the answer to your question about aging is yes, aging commonly raises blood pressure, but normal aging shouldn't. And the more proactive we are about our exercise, our diet, not smoking, consuming adequate amounts of micronutrients, and that usually means supplementation because our food quality is worse and worse and worse as the years go by, that we, even if we eat from the rainbow, we are often still micronutrient deficient. It's very hard to get 7 to 10 servings of vegetables every day to get enough micronutrients to meet those demands. Also, inflammation is a problem. As we age, many of us will develop periodontal or gum disease, and this is a primary driver of inflammation, which can raise blood pressure as well. So if we don't have good, healthy teeth in our older years, we're going to suffer the consequences of inflammation, and that can include hypertension. So what are some other contributors? Well, I think we know that sitting is the new smoking, right? Being physically inactive, and the most exercise that you get all day is on your cell phone or the remote control. This is terrible for our hypertension. We need to move. Our body needs to move. And so getting a standing desk or a treadmill desk or elliptical that you can use it in your office so that periodically you need to step away from your computer and move. This is a hidden risk factor. Not getting adequate sleep. And this is tricky because I thought I slept well. I sleep 7 to 8.5 hours every night. I wake up refreshed. I'm not tired in the day. I go. I get in bed by 9 o'clock. I'm up at 5, and that's how I do my day. Then I went on vacation with my siblings, and we stayed in a cabin. I'm the oldest of 6 kids, and we stayed in a cabin, and all the siblings were together. And my little sister hurt my feelings when she said, "Ellie, you snore worse than Susan does." Susan's my other sister. "What do you mean I snore worse than Susan? Susan peels the paint off the wall. I can't snore worse than Susan." "Oh, yes. I didn't get a wink of sleep between her in one ear and you in the other. It was terrible." So I came home and I said, "Jim," I've been married for 30 years now. I said, "Jim, do I snore?" He goes, "Like a sailor." I said, "What? I snore?" He goes, "Yeah. And sometimes you stop breathing when you sleep. I stare at you and I watch and I wait to make sure you keep breathing. You scare the crap out of me." I'm like, "Why didn't you tell me?" He said, I thought you knew. I said, I didn't know. Nobody ever told me. So I immediately ran off and had a sleep test. I have sleep apnea. Who knew? I have sleep apnea. And I was shocked because I don't have hypertension and I don't have daytime sleepiness. And yet I have this condition that can lead to, over time, obesity, hypertension, heart attacks, strokes, premature death, driving in a car accident, all these things from untreated sleep apnea. So my sleep apnea was mild. It didn't even qualify me for a CPAP machine, which is probably good because I didn't really want one. It's like, wait, there's other treatments for sleep apnea besides a CPAP mask? Really? What might those be? So I went to go see a dental sleep medicine specialist. Dental sleep medicine is a specialty all in itself. When I was 16, I was in braces, and they pulled 4 teeth for me to have my braces. So I had 4 teeth extracted, perfectly healthy teeth. If I knew then what I know now, that wouldn't have happened. But back then, we were following the best standard of care orthodonture. They pulled 4 teeth. They put me in headgear. I got to wear that lovely headgear that
Me too, to
pulled my
school.
entire face backwards. Yeah.
Yeah. Uh-huh.
Shortening my airway by about 15 millimeters, guaranteeing that there would be no room for my tongue as I got older. So I had to undo that shrinkage of my mouth that my orthodontist did to give me a cute smile with straight teeth. So I ended up in a Vivos device that had a key in it that I would advance the key and stretch my palate and stretch my mandible and expand forward the shape of my face. So I gained about 10 millimeters of that 15, which was just enough to pull my tongue forward and reduce my snoring. But now I had to retrain my mouth. So I had to go to myofunctional therapy, which is like physical therapy for your jaw, lips, and tongue. And we learned how to do these little exercises to get your tongue and jaw moving. I lip taped. So I use micro pore surgical tape to tape my lips closed to keep my jaw closed so that I don't snore anymore. I don't even need the tape anymore. I'm 3 years into this, so I don't need the tape anymore. I wear it sometimes because I kind of feel like I wake up with less bad breath in the morning if I lip tape. And then I'm now in Invisalign to finish up straightening all those spaces that they created when they made me a bigger mouth for room for my tongue. So I don't have sleep apnea anymore and I don't snore anymore. And it's been a permanent cure for me. So that's nice to know that there's other treatments besides sleep CPAP mask.
What was the name of that type of professional you saw again? Would you just repeat that?
Certified dental sleep medicine.
This episode of the Nourishing You podcast is brought to you by Good Fight. Good Fight was founded and developed by Amy Puzzi, a holistic nutrition professional, competitive trail runner, and mother of 4. Good Fight is a product based on the enzyme phytase, which assists with micronutrient and amino acid absorption by neutralizing the anti-nutrient phytate. The company has seen significant results in clients with gut-related issues, anemia, and a number of autoimmune conditions. Good Fight's vision is to be a catalyst for improved global nutrition and immune health, with a long-term vision of eliminating hidden hunger and micronutrient deficiency globally.
Okay.
Yeah, I bet a lot of people don't know the relationship between sleep and high blood pressure.
Yeah. So imagine, part of the problem with sleep apnea is that your oxygen levels are dropping. So in the middle of the night, while your oxygen's dropping, your blood vessels, your heart, your brain are being choked. And there's a lot of strain against those organs. So they have to pump harder to move the blood because there's not as much oxygen. So they're trying to get circulation. So they're working harder. So if we can improve your nighttime oxygenation, we can make a big difference. Another connection to this is mouth breathing. Many people who are snorers are mouth breathers, right? Well, when you mouth breathe, you tend to dry out the mucous membranes. That shifts the normal microbiome. Many of us are familiar now with the idea of a microbiome in our gut. We know about the role of probiotics and getting those friendly bacteria into balance. Well, we have a unique microbiome in our mouth. We're supposed to have teeming bacteria in there. But when bad invaders move in is a problem. That's what leads to gum disease, periodontal disease. But on the crypts of our tongue, in the back of our tongue, are these little bacteria that make an enzyme called nitric oxide synthase. And nitric oxide synthase is the rate limiting step in a physiologic process that makes a gas called nitric oxide. This miracle mouth molecule is so important, it won the Nobel Prize. It's a signaling molecule, and it opens and dilates blood vessels, it regulates our immune system, and it has hundreds of newly discovered pathways that it affects. But one of the major ones is relaxing blood vessels. So as they were studying this miracle molecule and trying to create a drug that mimicked it, they came up with a drug. They were studying drugs to make a blood pressure medication that would open and dilate your blood vessels. Well, it opened and dilated blood vessels better in the pelvic floor than it did in the heart and the rest of the body. And that drug came out with a new name. It's called Viagra. It works on the nitric oxide pathway. It's not a very good blood pressure drug. But all the men who were taking it for this blood pressure came in and were like, I have a side effect, and I am so proud to tell you about the side effect that this blood pressure medicine worked. I love this blood pressure medicine. Well, like, unfortunately, it's not controlling your blood pressure. I don't care. I'm taking it anyhow.
And you're like, TMI, TMI.
So we know how valuable this nitric oxide pathway is. And it's not just for men. Women get pelvic floor congestion from high blood pressure too. And we get microscopic vessel damage in our pelvic floor too. And so enhancing the nitric oxide pathway by enhancing our oral health, keeping our chins closed at night so that we don't mouth breathe, so that we have a better pH and we have these better mouth bacteria, we make more nitric oxide synthase, all of a sudden our sex life gets juicier too. So it's quite fascinating to me, some of these hidden causes, such as mouth breathing, that can lead to hypertension.
Yeah, lots of oral systemic connections in the body, blood pressure being a major one, but yeah, so many. It's a fascinating area that, again, doesn't get talked about enough. So maybe that's another episode we'll have to do with you, because I think there's a lot more we could explore there. Do you think, because all of these different reasons that you've described here, potential reasons for why somebody might have high blood pressure, none of them are, necessarily easy, here, go do this and it'll get better, like a one-to-one thing. It's like there's a myriad of things. Is this why medication is the first line therapy and physicians aren't talking with their patients about other things that can be done for their high blood pressure? I mean, I know that we're told to reduce salt, like that's
right.
Stop eating salt and take this prescription.
Right.
Can you expand on that anymore? I mean, you've got a little bit of, you've got both sides in your training, so I'm just curious.
Yeah. Well,
what your thought is there.
Unfortunately, there's really not a lot of a lot of money in medicine in prevention. So the primary care doctor could see a patient for 10 years to try to control their blood pressure and keep them off dialysis. But the minute they go into dialysis, that nephrologist made more money in 2 visits than that primary care doctor made in 10 years off of that particular patient. Because there's big money in dialysis. There's big money in interventions, cardiac care, stroke care. There's not a lot of money in prevention. So in order for a primary care doctor to make a decent living, we got to see 20 or 30 patients every single day. 40 patients, 50 patients, depends on the clinic. And so there's only time to write a prescription. There's not time to sit down and have a conversation and talk about, how late are you drinking your caffeine at night? Oh, well, you have a genetic metabolism that results in the inability to metabolize caffeine. It's keeping you awake all night. You're awake all night, now your blood pressure's high. Let's only drink caffeine in the morning and not after 10 a.m. and watch what happens, right? it takes time to be a detective and to do those investigations. And often genetic testing is not covered by insurance because it's preventive. So we have a double problem. There's not a lot of money in prevention. There's money in treatment. So that's part of the problem. I think also a huge part of the problem is our Food and Drug Administration, right? Why did we put food and drugs in the same place? It doesn't make sense, right? So the more our food is corrupted, the more drugs we need. So let's keep making more and more frankenfoods that our body doesn't know how to metabolize, that are genetically modified and foreign to our microbiome and foreign to our gut cells and lead to inflammation and oxidative stress and immune dysfunction, and that results in hypertension. So we have to go back to that biodynamic farming and that natural foods, the way that God intended for us to eat. We need to eat the things on our planet that were provided to us and not try to make them better. They were already great. We just need to ingest them and avoid these genetically engineered, modified food products that the food scientists are working so hard to create, super addictive foods that have this great mouth feel and this high fat content and high sugar content that so many of us grew up on and learned to love. You know, when we were kids, we might have had a box of Twinkies in the house occasionally, once a month. They weren't there every day. They weren't there for us to have with every single lunch, right? They were a once in an occasion treat, but over the years, our expectation has shifted as to what is a treat and how often should we have a treat? And do we deserve a treat every day just because we're special? And I think that shifted how we eat. Counseling people on food and nutrition is hard. I had one professor tell me that it's harder to change somebody's diet than it is to change their religion. And I almost believe that. You know, we come to food with cultural expectations and family traditions and this whole thing about textures is kind of new in this generation, but some people can't eat certain food because of the mouthfeel that it has or its texture. And so as a result, we're narrowing and more narrowing our food choices, and our gut likes diversity. The more diverse our diet, the more diverse our microbiome. The more diverse our microbiome, the healthier it is, the better we can make things like nitric oxide synthase and other enzymes that drive our metabolism and help keep our weight down and our blood pressure under control. So I think it's just not an easy answer other than the system that we've created for healthcare is really about sick care, not prevention. It's really about intervention, not prevention. And when you're talking about hypertension, it's more of a preventive strategy. So there's not a lot of money in it and there's not a lot of emphasis on it, which is why I think people should be empowered with information. They need to know what their risks are. They need to know how to check it properly, know what their maximum acceptable is, and then have some good strategies. You know, you brought up salt restriction as a condition. Well, I think the evidence says only 30 to 40% of people are truly salt sensitive. And yet we make that recommendation across the board for everybody. Well, that's not fair. And I also think that which salt you choose matters. Like we know in general, white bread and white potatoes are not as good for us as healthy colored potatoes and healthy brown rice and healthy brown bread, more so than white bread, whole grain, right? So white salt is processed and not so good for us. If we use a mineral-laden salt that's colored, that's pink or brown or gray, these salts have minerals in them that help counterbalance some of that sodium. In my experience, most of my salt-sensitive patients were really just deficient in either zinc, magnesium, especially magnesium, or potassium. And if we get those micronutrients depleted, they can handle that salt without a spike in their blood pressure. And the only way to know if you're salt sensitive is to do the test, is to take yourself off sodium, go way down 2 grams of sodium or less, Do it for a week, check your blood pressure multiple times, see how you do, liberalize your salt, let yourself have as much salt as you want, see what your blood pressure is and compare the two. If you're salt sensitive, you'll see a significant difference. If you're not salt sensitive, you won't, and you don't need to restrict it just because your doctor told you to if there's no clinical difference in the numbers.
Yeah. Unless it's attached to those processed foods that you were talking about, and then it's probably not good for you no matter what.
Right.
Yeah, ditch those Doritos.
Right. And they all come with, probably worse for you than the salt is the seed oil, right?
Yeah.
Whatever it's fried in. So we want to
Right.
avoid that sunflower oil, safflower oil, canola oil. These seed oils are just so omega-9 inflammatory. They get oxidized through this process of oxidative stress and not having enough antioxidants in your body. And when that happens, it can take over 600 days to clear that oil out of your system. So
It's a long time.
so we end up stuck with these inflammatory oils. So just avoid them. It's better. You can now find, if you look hard, even if you're going to eat potato chips, try to find them in avocado oil. Try to find them not in canola oil.
Yeah.
Or make them yourself at home in your air fryer.
Yeah, exactly. Even better, right? So I think, very frustrating, but empowering at the same time, to think about what all these different causes are and what we can do about it and how we can start taking some control over it besides just taking salt out of our diet. So you've mentioned several different strategies, but I'm wondering if we could kind of just package them up because they've kind of been thread throughout the conversation here today. What would be like your top 5 things for someone who is currently experiencing high blood pressure, or they know they're pushing the limit? What would be the top 5 things that you would have them begin to get a hold of in their nutrition and lifestyle to start getting a hold of their blood pressure?
So the first thing is to get data, right? We like to see the data. So home blood pressure monitoring and frequent data collection. Doesn't have to be 6 times a day, but a time or 2 a day, 6-7 times a week is a good starting place to check your blood pressure and know what your maximum acceptable is, because your doctor may have a different appreciation for what normal is. And then you can have a conversation. What do you mean 140 over 90? I thought I had to be 130 over 80. And then you can have a conversation about what maximum acceptable is. So proper measurement. Most people are doing it wrong. There's some things in my book. Don't have a full bladder, sit on the chair, bottom to the bottom, back to the back, feet on the floor, can't dangle your feet, arm has to be bare at the level of your heart. So simple things about properly checking. Next, you got to eat clean food and drink clean water. We don't want to be drinking pesticides and artificial flavors and artificial colors, and we don't want crap in our body if we can help it. Avoid those seed oils and high fructose corn syrup and try to get a plant-based whole food diet. Avoid things that come with a barcode on them. How did Mother Nature make that food? That's probably how you want to eat it. Next, micronutrients. I think the vast majority of my patients are magnesium deficient. We can do a magnesium blood test, and when we check it, I want it in the top third of the reference range for your lab. So for my lab, that's generally speaking around 2.2 to 2.4 is where I want that magnesium level. Don't settle for a 1.7, even if that's in the reference range. We want it near the top. And sometimes just taking magnesium will solve a blood pressure problem. Sometimes just switching your salt for light salt, which has more potassium chloride than sodium chloride. If you use a light salt, in some cases that can solve your blood pressure problem. So micronutrients. Next, the third, or I guess we're up to the fourth thing now, is sleep. Make sure that you're getting deep restorative sleep. If you snore, if you wake up fatigued, if you are getting up at night to pee 6 times, you are not getting deep restorative sleep. Consult with your primary care doctor or a sleep medicine specialist, whether that's a dentist or a medical doctor. And we want to make certain that you're getting your adequate, deep restorative sleep. And don't be afraid to get a sleep study, because not everybody needs CPAP. There's many other options for treating sleep disorders that aren't CPAP. And then the final thing is to see your dentist and get a good deep assessment of your gum and tooth health. You should have no pink in the sink. You should never have bleeding on probing when they check you with that little pokey thing. You should not ever have pocket depths deeper than 4 millimeters. If you do, there's a problem. There's inflammation in your gums, and inflammation in your gums makes inflammation in your gut, and inflammation in your gums makes inflammation in your arteries, and that can drive high blood pressure. So we're going to know our numbers, check adequately. We're going to eat clean food and drink clean water. We're going to replace our micronutrients. We're going to get sleep, and we're going to see our dentist. And if we do those things, we can get our blood pressure under better control, and we can recognize that we're treating the underlying root causes that treat hypertension, because heart attacks are optional, strokes are stoppable, and dialysis is not your destiny if you're willing to get the data and do the work.
Fabulous. That was a fantastic wrap up of that. So one caveat I just want to ask about, well, actually two, because I know we'll have some people in the audience that say, oh, she said I should take magnesium for my blood pressure. And there's lots of different types of magnesium out there. And so I personally would say avoid magnesium oxide. Do you have a particular type that you like to recommend?
Yeah, I like magnesium, which is chelated to an amino acid. So that's usually magnesium malate, magnesium glycinate, magnesium threonate. If you have gut trouble, if you're constipated, magnesium citrate is a nice choice because it's kind of a laxative. But if you don't have that and you take magnesium citrate, you're going to get diarrhea. So I don't generally recommend magnesium citrate. Glycinate, malate, threonate are my 3 favorites. And I use threonate especially if there's overactive brain. If you're a thinker that can't turn your brain off at night, if you suffer from anxiety, OCD, anxiousness, magnesium threonate is a good choice for you. I take a combination one. It's called OptiMag, magnesium glycate, magnesium malate, 2 together in 1 capsule. I take 3 once a day, every morning, and I poop like a champ, and I never get leg cramps. If I forget my magnesium, I will be up at night going to the kitchen to remember to go take my magnesium because my calves will cramp at night. So magnesium has been a miracle for me to get deep restorative sleep.
Good. Okay. And then the other thing that was just on my mind about this is somebody's already diagnosed high blood pressure and they're on medication and let's say they start doing your top 5 things. Do we want to make sure they're continuing to monitor because they may need changes to their medication with this, correct?
Absolutely.
And we don't want to be
data, right?
Right.
And if you bring to your doctor 15 blood pressure readings at home that are all less than 130 over 80, or even better, less than 120 over 80, you need to bring that to your doctor's attention and say, I think I'm ready to back off my blood pressure medicine a little bit. How do you recommend we do that? Now, if your blood pressure gets below 120 over 80 and you're weak and dizzy, or you feel like you're going to pass out, that's a more emergent call. Don't wait till your next routine visit. Call right away. So I'm doing these therapeutic lifestyle things and now my blood pressure is too low. What should I do? Because we don't want you to risk falling down and breaking a hip because you're doing all the things and now you don't need blood pressure medicine anymore.
Right.
No falls.
No falls.
Yeah. You know, Dr. Campbell, one of the reasons we wanted to have you on the show today is that you're such an excellent health communicator. You have the ability to take complex, cutting-edge medical topics and make them really easy to understand and simple to integrate into your life. So I know this show is going to be incredibly practical for the listeners. Before we wrap, though, we'd love to know what your secret is to staying so vibrant. You were talking about you have endless energy. So what's your secret?
Sleep. I don't compromise on my sleep. I'm usually in bed by 9 o'clock. My daughter, when she was a teenager, she came home from babysitting one time and she said, Mama, I had to go babysit to learn that normal people don't go to bed at 9 o'clock. And I don't like to compromise on that. If I have a special event that keeps me out late, it upsets my schedule and I don't do well. So sleep, solid 8 hours almost every night, mandatory for me. I don't take any prescription medicines other than my hormone cream. And I take fistfuls of supplements. So I'm sure that I'm replacing all those micronutrients. I do a lot of blood testing on myself, and I check my potassium and my magnesium and my zinc, my vitamin D, my B12, my folate. I make sure that all those things are not just normal, but in the optimal reference ranges. And by keeping those things in the optimal range, I believe that I've been able to slow my aging process and still have the vibrancy to keep working full time and write books and speak and do podcasts and all the things that I like to do.
That's fantastic. And, you know, if you're listening and you don't have a physician that does that kind of testing for you, and that's something you want to pursue, there are integrative physicians like Dr. Campbell out there. There are also holistic nutrition therapists that are trained in functional lab work, that type of thing. And so seek out somebody that can help you do it, because it's available to you. And so
and it's available online now. It didn't used to be, but the state is taking away a lot of my telemedicine privileges starting in May. So for physicians, it's being restricted, but for coaches and nutritionists, it's not. So by all means, find somebody to work with. Because
not yet. We'll see. But there are people out there. So just know that, you know, you don't have to do it alone, and there's people that can help guide you through the process. Okay. So lots to take away from our conversation. And if you haven't read Dr. Campbell's book, The Blood Pressure Blueprint, I got it actually right here as well. We know you'll find it extremely user-friendly and practical. And, you know, we're not here to promote books and things like that necessarily, but this was a topic that I felt needed really relatable, practical information. And I feel like your book does that. So I'm not ashamed to put that out there whatsoever.
Oh, thank you. And thank you for your kind words. You know, I'm just here to share what I have, 35 years of clinical experience. And we've been doing blood pressure a lot. And now that we know what a contributing fact the mouth has to the rest of the body, I just want to scream it from the rooftops, because if I'd known then what I know now, we might have been able to prevent Dee's tragic premature death. And so in her honor, I wrote this book. In her honor, I studied hard to try to figure out what was that missing piece. What did I overlook that allowed that stroke to happen while following the best evidence-based guidelines of the experts in the industry? What was it? And it wasn't anything anybody ever taught me. So now I feel compelled to teach the world to take care of your mouth, to take care of your brain and your heart.
Well, we're going to help you shout it from the rooftops. And for the listeners, please share this with your friends and family. We want to help Dr. Campbell get the word out, so please share it. And thank you so much for being on our show. We really appreciate it. Can't thank you enough. And thank you to all the listeners, as always, for tuning in. We can't wait to see you next time. So until then, take care.
This episode of the Nourishing You podcast is brought to you by Good Fight. Good Fight was founded and developed by Amy Puzey, a holistic nutrition professional, competitive trail runner, and mother of 4. Good Fight is a product based on the enzyme phytase, which assists with micronutrient and amino acid absorption by neutralizing the anti-nutrient phytate. The company has seen significant results in clients with gut-related issues, anemia, and a number of autoimmune conditions. Good Fight's vision is to be a catalyst for improved global nutrition and immune health, with a long-term vision of eliminating hidden hunger and micronutrient deficiency globally. For more information about Good Fight, visit www.goodphyte, that's GOODPHYTE.com.
If you'd like to access other episodes or subscribe so you don't miss a beat, you can find us at nanp.org/NAMP-podcast.
Looking for a board-certified holistic nutrition professional to support you on your health journey? Go to nanp.org/find-a-practitioner and get started.
Membership in the NAMP provides you with a competitive advantage. Whether you're a current practitioner or a student, We want you to become an active, informed leader of the holistic nutrition community and join NANP.org today. Are you ready to go a step further? Boost your credibility with board certification in holistic nutrition. Visit NANP.org today to apply.
Keep in mind that the information on the NANP podcast is for educational purposes only and should not be considered medical or legal advice. The NANP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NANP and all agents. Copyright NANP, all rights reserved.
Until next time, stay nourished.